Hello and welcome to How Would You Rate Your Pain? We will be exploring life, loss, love, and the power of resilience. I am Dr. Tiffany Bartell. Thank you for listening, and I can't wait to go on this journey with you. Well, hello and welcome to another episode of How Would You Rate Your Pain, the podcast that covers life, loss, love, and the power of resilience. I'm your host, Dr. Tiffany Bartell, and I'm really excited about the guests we have today. I have my friend Courtney. We've worked together in the community for many years, and a new friend, Allie. And so today we're going to be talking about our relationship with our bodies, our relationship with food, and we couldn't have two better experts to talk to us about these important subjects today, especially in the time that we live in. So I'll give you guys a moment to just introduce yourselves and tell the listeners a little bit about what you do in the community.
Okay, I'll start. I'm Courtney Stoddard. I'm a registered dietitian and a certified eating disorders specialist and consultant. So I work at Focus Treatment Center. It's a local family-owned treatment center, and for 20 years we've been treating eating disorders at the residential level. We have lower levels of care as well, and I have different roles there, but my main one is an outpatient dietitian, and I see folks in the community who struggle with eating disorders and disordered eating and that kind of thing who are appropriate for outpatient care.
I love that. And you do great outreach and programming. When I was working as a university college counselor and doing some of their programming, Focus came in. We did a Southern Smash event. So fun. They get to write messages that they've received or they want to reject about their body on scales. And the most fun part that made campus safety really uncomfortable is they get to smash the scales with a sledgehammer. Safety glasses were used. We were so safe. But also just so many other events. And you guys always have good swag. And so we love everything that Focus does in the community.
Yeah, we love partnering with colleges especially to do things like that.
Well, and we'll get into that a little bit. That's really a vulnerable demographic, and we see so much onset, or kind of that crisis stage, during that age period. And so we'll talk about that. And I also want to put a pin in, you mentioned eating disorders and disordered eating. And so maybe we can just kind of touch on what the difference is, with those two. It's going to be really good.
Yeah.
Okay, Allie.
Hello. So I am Allie Haskew. I got my start in eating disorder work actually with Courtney at Focus Treatment Centers, where I worked for 2 years at the residential level. Currently, I am a licensed professional counselor, mental health service provider at Chattanooga Counseling and Consulting. So I'm working with an outpatient client base, seeing a variety of different psychological needs and concerns, but primarily eating disorders and disordered eating. Yeah. And I'm also certified in intuitive eating. So I can provide services around really how we get back to trusting our bodies around food, which we can also talk more about if we need to. I'm sure we will.
Yes.
Yeah, so I really enjoy the one-on-one experience, getting to sit with my clients in the room and help them kind of find their way back to their bodies is how I describe it.
Because we're not born with these attitudes towards food or bodies or feeding. Yeah. I love that. Yeah. So, what brought you guys into this work specifically?
Yeah.
As much as you feel comfortable sharing.
Yeah.
I can go. I actually fell into working with eating disorders as my first job. Just kind of was trying it out. And luckily had great mentorship and training. And so, I fell in love with the work and the team that I had at the time at this treatment center. And now I, want to keep doing it because there is such a need for help with people who are just trapped in their heads, essentially with disordered eating thoughts, and to help them see that there's another way and help them walk that path and see them actually start to enjoy life again is just really amazing.
So rewarding. I love that. And, I think that it's not a quick fix, either. You have to live life a completely different way. And you need help, to do that. It's not something, once you get in the throes of it, you can really kind of wrench yourself out of.
Yeah. It really does take a team.
Absolutely.
Yeah. Okay, how about you, Allie?
I would love to have a different answer than Courtney, but I also kind of fell into it. I was in the counseling program at Vanderbilt and graduated, and initially thought I was going to do substance use work. Came to Focus thinking I was going to get a job in substance use. They had an opening on the eating disorder unit.
Yeah.
And I fell in love with it. I got trained. I worked as a weekend as needed counselor on the eating disorder unit to start, and then actually as a mental health technician. So somebody who helps run the unit, has meals with the patients, helps
day-to-day schedule.
Yeah, day-to-day schedule running, things like that, which gave me a really great insight into how a residential treatment facility runs. And then stayed there and really realized that's what I wanted to keep doing. I had gotten some training in chronic pain and chronic illness when I was in grad school, and realized there's actually a ton of overlap. And what that work is like, it's both are so obviously mind-body oriented, and it just felt like a really natural switch that aligned with a lot of what I believed and wanted to do anyway. And so, I kind of fell into it, and also wouldn't have that any other way.
I love that. Yeah. Well, and it is such a specialized niche area. And I think that, I think that can be actually validating for people who are struggling with either an eating disorder or disordered eating, because, sometimes we judge ourselves for not being able to kind of like pull ourselves up by our bootstraps or figure it out ourselves when, professionals have to get specialized training to work with it. How could we do it on ourselves?
Right. Yeah.
So what did that training look like for each of you to be able to work in this specialized area?
Well, for me, dietitians actually don't get much training in eating disorders in our school or internship. So it is important for that reason to find one who does specialize in that. But so I had a great dietitian mentor who would come in from Arizona once a month to work with me for a week, and this went ongoing for years as I was there. And of course we had other dietitians come on and train them the same way, as well as a doctor who specialized and would do the same type of consulting. And so that was just me and something I was fortunate to have. Obviously it's not needed to have that kind of mentorship, but definitely a bonus for me. And I went through IADEP, which stands for International Association of Eating Disorder Professionals, to get the certification, which is out there and available to all, most all professionals that, want something like that. And we have to take core courses and an exam, as well as having a certain number of hours of work and experience, along with a bunch of other things. So
that's a lot. How many years would you estimate it took you to get, kind of to a place where you had your certification and you felt like you were really confident to practice independently? I mean, we all do consultation, but,
Yeah. Well, I started outpatient in 2017. So I don't know. It probably took me like 5 or so years to kind of feel confident in that. And I'm still like learning every day. And, we never stop learning or needing the help of others on our team.
I love that. How about you, Allie?
So as you mentioned, in most grad programs for counseling, you might briefly touch on eating disorders in your DSM course.
If you're lucky.
But there's really next to no training on eating disorders. And so really when I started at Focus, I was like, I don't know what this stuff is, but sure, we'll give it a shot. And was just really fortunate to have a team there that believed in my counseling abilities and was willing to foster that growth. So fortunately I had been under some care and instruction, Courtney included in that, by people who had been in the field for a while, as well as having my own supervisor towards licensure, who had experience working with eating disorders as well. So she could help kind of guide that growth process for me. In terms of how long it took before feeling comfortable to be out on your own, that's such a good question. The difference between residential treatment versus outpatient work with eating disorders is huge.
Yeah.
Because there are a lot of differences in kind of what you can work with on an outpatient level.
Right.
And so
when you don't have that interdisciplinary team necessarily.
Right. Yeah. And so part of it for me that eventually helped me feel more confident to move was being able to see, okay, this is what I can look for to know when I'm not enough. And sometimes I think as therapists, that's one of our most important skill sets is being able to know, and to be able to know when we're not enough, right? And so once I felt like I had a good handle on really how to assess, be able to tell client needs, and really just kind of work through that imposter syndrome stuff, which never goes away.
No, I've made it my friend, but
you learn how to tailor it. But felt confident in my ability maybe to reach out to the appropriate resources with the imposter syndrome.
You know where to go.
Exactly. Then I felt kind of ready to make that switch. And then the intuitive eating counselor, the certified intuitive eating counselor, I got that certification end of last year. I started exploring that actually as a result of my own work towards becoming an intuitive eater myself, abandoning diet culture, breaking up with Weight Watchers, that whole process. And
excellent chapter titles for like a book. I'm just gonna like throw that out there.
After that, I was like, this is something that has pretty drastically changed my life. I think I was 4 years into intuitive eating at that point and decided that I was really ready to start doing that work with other people and helping people through that. And so it's not nearly the intensity, I think, as your certification process, but similar thing of you do exams, written exam. You have to have a certain number of supervision hours with either Evelyn Tripoli or Elise Resch, who created intuitive eating.
Wow.
You had a lot of classes too, right?
Classes. There's webinars. All of these things that
I love that it's so structured and such a great learning experience. And and I think that's really encouraging, to find something that works for yourself and then be able to do that. I mean, as people working in the mental health field, I feel like it shows up in our treatment if we're not doing our own work. Even if it's just like, are you doing mindfulness? Do you sleep? Do you get exercise? Whatever.
My boss, actually, we had a conversation about this in a supervision session one time, a consultation session, where I was explaining how one of the challenges of doing body image work in particular is it is a kind of a baby field. Not a whole lot of people have done a whole lot yet with it. And
absolutely.
I was saying, it's hard to do stuff when, I'm a whole human with a body. That's a hard thing. And we talked about, he used a metaphor of how it's almost like walking through the forest with a machete and chopping down the trees so you can have the other people come along with their machete and do it too. But you're clearing the way.
It's pioneering.
And because of that, going through my own work and my own process with intuitive eating, I actually use that a lot more in sessions than I ever thought I would, because we don't have a ton of modeling for it. A lot of people don't see their moms work through their body image stuff. We don't have a model of what that looks like. And so, it's a really helpful tool, obviously, for myself and my own growth, but to have done the work and know what it feels like when you're sitting in the room with a person. It's really helpful.
I love that, because we all have bodies, and so little self-disclosure. I think I mentioned it to you, Courtney. So I had an eating disorder, high school into college, about 7 years. Came to kind of a critical point. Almost died my junior year of high school, and so part of my recovery, process staying in that is not, I don't treat eating disorders, but I do think that, what I've realized over the years doing my own work is it's so different than other things. If you have a substance use disorder, you can cease. You need to, abstain. But for people struggling with their bodies, you can't not look at your body. If it's food, you can't, it's always food, right? You can't not eat. You have to find a way to exist. And so there's absolutely no avoidance strategy that is going to be successful, which really pushes you into either staying in that unhealthy place or revisiting it in a very frequent, distressing way.
Yes.
Or you have to totally, change the way you think, change the way you feel, and change your practices in a world that doesn't support that.
Yeah.
Yeah,
there's a doctor at a eating disorder conference I attended a few years ago who said, with substance use disorders, you have a tiger and you have to lock it in the cage. And with eating disorders, you have a tiger and you have to walk it 3 times a day.
Oh my goodness, that's, yeah. Ooh,
and then
that's a really good analogy.
There are many people who have both tigers also.
Yeah.
So, a lot of times it is co-occurring and
Yeah, I wish you could just have one DSM diagnosis. No trauma, no depression, no whatever.
Yeah.
So, the question I get asked a lot, I think, as a mental health professional is usually by someone who has no experience having, anything related themselves, is don't you think it comes from this? Or don't you think it's this, So, what's your answer to the question that people have of, where's this come from? Because a lot of people say, isn't it true that everyone who has an eating disorder had trauma? And when it's well, isn't it true that, most people in the world have had some kind of trauma,
Right.
But I feel like there's this desire to have a formula or a specific thing to blame or something to pin it on, which seems a little oversimplified, but I don't know. What do you guys say to questions like that?
Well, I said that there's multiple contributing factors always to the development of an eating disorder. And so it could be having some trauma, but not everyone does.
Right.
Could be some genetics because there is
That hereditary,
a link there.
Yeah.
And it could be, dieting as a contributing factor, or growing up and witnessing that in their household. There's just so many different things that can contribute and that do. And there's a saying that genetics loads the gun and environment pulls the trigger, because someone who is genetically predisposed, who may go on a diet in high school with their friends, could have a very different outcome than their friends.
Right,
and that could be the thing that sets off their eating disorder.
Yeah.
Yeah, I love that. Yeah.
Yeah, I think the number one thing that I tend to hear is it's about control, isn't it? And I don't, which definitely comes up in eating disorders a lot. There's often a major control component, but I think somewhere along the way, that's what everyone started to hear, and that's kind of the thing that
makes sense.
Yeah, it makes it feel like we've got it figured out, which is a nice way to feel when something is scary and hard to talk about.
But what other DSM diagnosis do we have? And so when we're talking about the DSM, that's the diagnostic manual that we use in, so anxiety, our trauma responses or disorders, depression, eating disorders. There's a lot of things in there, and so, but yeah, have we figured out a single origin driver for any mental health condition? I don't think so. Because I don't know about it.
Yeah, one of the explanations that I'll often give is that, and this is kind of my conceptualization, but I think humans can kind of boil down to being 2 things: meaning-making beings and need-seeking beings. And I think a lot of our mental health issues, eating disorders included, are ways of navigating those 2 things.
Meaning and getting our needs met.
Yes.
I like that.
And so one of those needs might be control, and there might be meaning that we've made around what control looks like and how to get that.
It could be love.
It could be love
and acceptance.
Yes. It actually could be connection, even though eating disorders can tend to push us away.
Isolating.
We can also communicate a lot via an eating disorder too. So that's when I'm working with people. Those are the 2 things that I'm kind of exploring are what are the needs? How is this filling needs that have been met? Because we can hold space for that and honor that.
Oh,
That's really important.
Yeah. And there's even maybe better, easier ways.
Yeah, exactly. Can we find a more direct way to meet them? And then how are we understanding ourselves, understanding our existence in the world? How is the eating disorder maybe showing up as a way to also manage that piece? That's kind of the lens that, from the therapeutic end, that I'm assessing for. And that's usually a longer answer than maybe people want to that question.
Well, and I kind of wonder about like people who want to kind of distill down. It just seems like another form of that psychological distancing of like whose fault is it or what's fault is it, so that I know that I'm safe and the people that I love are safe. It's like, oh, okay, and it's kind of the same thing as like, oh, if someone's sexually assaulted, like, well, what were they wearing? Where were they? What were they doing? Were they drinking? Because, it feels like, okay, well, if my daughters don't do that, if I don't go there, I won't be hurt. And so I think I think it's a good thing, like, before we ask some questions about things we don't understand, to like, just examine the fear, that might be pushing that, because that can be like a really hard question. I mean, you guys are professionals, but for someone who might be in treatment or might be struggling, I think those questions can be really difficult.
Yeah, for sure.
Yeah. And, in the big picture of recovery, it doesn't matter. It doesn't matter how it came about.
It's here.
It's here, and we have to deal with it, and we have to work through it and work on recovering. It is great information to go underneath, and when they're able to make those connections, connect the dots, and we can still do that with just current, okay, I use this behavior, why, what was underneath that, what triggered that. So
a lot of times that work can come later.
Yes.
Because there's so much, depending on the severity of the eating disorder and what's going on. If we're not eating food, we can't talk about trauma.
Right.
Like,
our brains aren't on board.
Your body's not safe. And if we're going to make your mind potentially a little bit unsafe by opening up it and looking at trauma, we want to know that your body is going to support you through that. And be able to. And so actually a colleague of ours would say that movement is a privilege of recovery. And so I've kind of adapted that, and I say
Me too.
Trauma work is a privilege of recovery.
Okay. I love that. Movement is a privilege of recovery and trauma work.
We have to lay the biological foundation first before we can start
stabilize the being.
Exactly.
Yeah, because I think that we don't really realize, how much distress and how fragile people can be when they're very acute, and it's a deadly disorder. And I think it was
the second
is it still?
highest mortality rate of any psychological disorder.
Wow. Yeah, and I think, so as you think about like the world that we live in, and eating disorders and disordered eating affects men and women both. But what do you think? We're not finding single origin drivers, but what do you think are some of the cultural and societal influences that make it really difficult to be healthy with our bodies? I just feel like most of the women that I know are at war with their body, and like, what a way to live when you are like, that's happening inside of you all the time. That's a really hard thing to live with. So what would you say are some of the influences or the things that the way we live that push us towards that?
Well, I think we're inundated with often misinformation with diet information. The diet industry is $1 billion industry, and they are out there promoting,
Every
certain foods are bad,
product and
weight loss, products. And so when men are seeing that constantly, then you're going to be thinking about that, questioning your own way of eating, and questioning your
how you look.
weight, your body.
Yeah. Yeah. When I turned 40, I don't know what happened with the algorithm, but like even Amazon Prime started like putting, I think our account must be under me, and I don't know like what got triggered, but then all of a sudden there was all these like burn fat and like weight loss pills showing up kind of on my home screen, and it was like, what is happening? I felt fine.
Yeah.
I'm just 40. I'm not dead.
Yeah. Well, and that's been an interesting thing too, is the shift to, I think something we're seeing with the like diet industry is a kind of taking over and a co-opting of people's value of health, and moving towards like the wellness culture mentality.
Okay.
It's
and
disguising itself.
Yeah, it's a lot sneakier.
Wellness.
Super sneaky.
It's like Weight Watchers changed their name to Wellness That Works.
Oh, really? I didn't know that.
I didn't know that.
Yeah, so that's why it's just WW now. That's what WW stands for.
Oh.
And so that makes it really confusing to know what is
what
misinformation,
is like,
right? And then what is actual
helping
health information. And you know, we've also made it seem like it's a moral issue to care about your health. And that's not necessarily true.
Yeah.
That everybody gets to make a decision about health for themselves, but we put a lot of you're good or bad for X, Y, and Z things, and most people want to feel like good people.
Yeah. And like, I was thinking about this the other day, like, isn't it weird for us to think that we can pick our body type?
Yeah.
Like, or pick, like...
It's like trying to change, I say it's like trying to change your shoe size or your height. Like,
right. Like, why would you think that you could influence that? Like, you have...
Right. Not realizing
your own. Yeah.
Everybody has their own genetic blueprint. Yeah.
Which is lovely.
Yeah, absolutely.
Yeah, that's so interesting. Yeah. So, you know, it seems like it's a lot of the advertising that we're seeing and kind of the, you know, the bombardment on social media and even where you shop and all of that, that kind of puts it in front of your face that maybe you should be thinking about that.
Yeah. I think that's a big thing.
It's a big thing for sure.
The weight loss drugs that are so popular right now
So
too,
scary.
and promoted by doctors and prescribed by doctors. It's just so, you know, accepted right now.
Well, and I think that like we're living in a time where a lot of discrimination is kind of frightening, you know, and, you know, if you think about it from like a social justice advocacy, you know, standpoint, it's really frightening to me, you know, the fat phobia and how it shows up in the way people are treated. And, you know, I have clients that, you know, have to deal with things going to the store or going out to eat and assumptions that are made or going to a health provider. And it's like, oh, you know, this
I have clients
is
that
really
will avoid
bad.
going to the doctor for that reason because they don't want to be told again, you need to lose weight.
Or have like assumptions made about like what they're eating or, you know, and treat it as if this, like you were saying, like there's some kind of like moral failing or some kind of a character defect or like, I think it's really fascinating in a bad way, the way that we kind of extrapolate out all these stereotypes, you know, either way.
Yeah. It's interesting for thin privilege in particular. So the ease that comes with being able to exist as a smaller person in the world. I think that's one of the only forms of privilege next to economic privilege that we talk about as if you can gain and lose it. And so that presents a lot of complications, I think. There's like that element of, well, why wouldn't you want to have that privilege, right? Which I think is really fair. And then when you're doing eating disorder work or disordered eating work, essentially what you're saying is, I'm going to abandon that thing that would make my existence easier.
Oh, wow.
And that's really hard to do. You're saying, I'm going to choose to be less safe. And that goes against everything that's ingrained in us from even a biological level as human beings, which is part of what can make this work tough is, you know, trying to really help our clients understand we're actually trying to create greater safety in the long term by making you feel really unsafe right now. But fat phobia, I would say, starting out in this career, if I could go back and change anything that I did as a counselor in residential treatment, it would be not acknowledging the realities of fat phobia and thin privilege. I think there was a part in my brain that was like, oh, you felt more comfortable in a smaller body, but that was just an illusion. Like,
No,
that's
you
fine.
actually were
Actually
safer.
were. Yeah.
Yeah. Which is why we need like structural, societal, organizational change.
Yeah. And that, I think, too, speaks to your question about like the importance of seeing people who are trained to work with eating disorders.
Yeah.
It's really easy, I think, if you don't have that much experience, to miss that nuance. And eating disorders have a lot of nuance.
Well, and then you set them at risk for relapse, I
Right.
would think, because when you get back into the world and you're like, this actually isn't working because you haven't established a different pathway to safety.
Exactly.
Wow, that's so fascinating. So let's talk maybe for our listeners about what's the difference between disordered eating and eating disorders.
Yeah. So eating disorders is a psychological disorders that meet certain criteria in the DSM and are present with abnormal behaviors around eating. And those behaviors include restricting, binging, purging, and excessive exercise. Disordered eating can, be any of those behaviors kind of to a lesser degree, doesn't meet the full criteria for an eating disorder. And disordered eating can even be like a strict or extreme diet.
Yeah.
Overeating, skipping meals. So things that we do, people
Restricting
without eating
after
disorder.
holidays.
That we might all, do occasionally, but it's on a regular basis.
Yeah. Okay. Yeah.
Would you agree?
Yeah, I think that really fits. And I think one of the crucial pieces for disordered eating, because I think when we talk about disordered eating, we can think of it as less harmful. And I don't know that that's true.
Okay.
I think it might not be as textbook harmful, but it's really insidious.
Yeah.
Because disordered eating is kind of like a baby eating disorder, but that's able to sneak by and exist without a lot of pushback. And so you can have somebody who has had just a terrible relationship to food in their body their entire life, but they still go to meals. They still probably get their nutritional goals met, but they feel tortured every time they eat. But that doesn't necessarily meet any of the diagnostic criteria for an eating disorder. And so there's a lot of mental warfare that still goes on with disordered eating. And it is absolutely a reason to seek therapy, which I think a lot of people don't realize. They're, well, I don't skip meals, so I must be fine.
I'm not underweight.
Yeah, but if you're also thinking for hours about how little lunch you can have so that you don't have to feel guilty when you go to that party because you want to eat as much as you can at the party, that's exhausting. It's taking up, that food is taking up too much mental space.
Yeah, like that. Yeah, that's really, and I think that's a really important distinction. Okay, so we talked about drivers, we talked about society, we talked about the difference between. So we're going to take a quick break, and after the break, let's talk about what do we do?
Yeah.
We don't want to live at war with food. We don't want to live at war with our bodies. How do we start that process of getting out of that?
Cool.
Okay, so we are back from the break, and now we're going to pivot into, okay, what do we do? Like, how do we form a healthy relationship? What does that even look like? I mean, how many of us organically know, what that is?
Yeah. It's a big question. It is a big question. Yeah.
I love the principles of intuitive eating
as
a start.
Yeah. Intuitive eating is a great approach. And as somebody who works with eating disorders and does intuitive eating, it's a delicate balance to find when to kind of incorporate that in. Because as we've mentioned, like when you have an eating disorder, we really just got to focus on kind of getting food in, getting you eating, even if we're disconnected from it. We just got to get the fuel in. And so intuitive eating comes a little bit later. Intuitive eating is when we
Is it a privilege of recovery?
It is a privilege of recovery. Yes, absolutely. And that's when...
And something, though, that everyday people can
do.
adopt.
Yeah,
Okay, I love
absolutely.
that.
Everyone can do it. There are different principles that allow you to, like, some of them are reject the diet mentality, honor your hunger and fullness, which is something we have a really hard time doing.
Yeah.
And respect your body, allow for movement. There are all sorts of ones. Gentle nutrition, which is a really sticky and interesting thing to talk about.
I don't think I've ever heard that phrase.
Yeah.
What does that mean?
Yeah. So gentle nutrition acknowledges that, like, health is important. Sometimes we have things that we have to do for our health goals, whether that's, if you have diabetes, right? We're going to eat in a certain way to manage our diabetes.
And or like hypertension.
Exactly.
Eat less salt. Yeah.
And those things are still intuitive.
Okay.
Which might be helpful to explain what intuitive eating is first.
Please, yes.
So intuitive eating essentially is the idea that when we are born, we're born knowing how to eat, right? Like, we cry when we're hungry as babies, we nurse, and we stop when we're full. As we grow and develop, we get all of these outside influences that make us second guess that. We stop listening to our bodies when it's sending a hunger cue. We subsequently eat past our fullness levels. We start ignoring our fullness. And so all of the different principles of intuitive eating are ways to try to get back to
the rhythm.
That rhythm. Yep.
Yeah, I love that.
Being able to trust your body's innate wisdom of what you need. And that might result in weight gain, that might result in weight loss. Neither is the goal.
Right.
The goal is just to start listening. And so, we use these 9 principles as a way to work ourselves back into that place. And
so it's very like holistic.
Yes.
And you mentioned earlier that like that mind-body connection, and it almost feels like, learning to listen to your body. It's so counterintuitive to how we live, especially in this country. We go to bed way after we start to be drowsy. We get up before we're ready to be awake. We work past when we have capacity to work during a day. It's just constant. We don't go to the bathroom when we actually have to go to the bathroom. So it just kind of makes me think about, like, what a natural, organic way. Like, it feels new, but it's really not.
It's really not. It's really old. I think it's a really interesting setup to the way that the principles work. And of course, it's not linear. Sometimes we might kind of ebb and flow within them, but it also focuses, the front part of your list of principles is really focused on the food. How do we get back to eating when we need to eat, honoring our hunger, all of that stuff. And then the latter half is more about the body work, the movement work. And I think that's really fitting, because usually the body image issues came first, right?
Okay.
We start to question what the food is doing to our bodies, and we start to tell ourselves these negative stories about ourselves. So that's going to be there for a really long time. That's a lot of life to start to work through.
And I think a lot of people try to, like, love their body first.
Yeah, and that's so far.
It's just like such a hammer.
And so it works a little bit more effectively. I was going to say easily, but that doesn't feel fair.
We wish.
Right. A little bit more effectively, starting with the food, kind of developing a change in that relationship, and then saying, okay, now let's tap into the body stuff, because that's a bear, but it can be done.
I love that so much. So, like, for listeners who might be kind of, noticing, like, oh, wait a minute, I call them cheat days, and I restrict the day after Thanksgiving, or I don't eat breakfast or lunch on Thanksgiving. Now, my children, if they listen to this, they know that I do not cook anything on Thanksgiving except for dinner, not because of food, but because of, like, sheer energy.
Yes, there's a lot that goes into it.
Make yourself a bowl of cereal, eat a sandwich. But if they're listening and being like, oh, wait a minute, I don't love my body, and I do worry about food and how much I'm eating and all of that. Like, what would you, have to offer them as, like, maybe a baby step or a first step?
So they could adopt one of those early principles and start rejecting the diet mentality. So meaning just try and listen to and notice what your body cues might be.
Mm-hmm.
Just the small step of like awareness
I love that.
could actually be a really big step for someone. And blocking out those diet messages.
Mm-hmm. So you might have to change your algorithm on social media, or take a little social media break.
Yes,
Mm-hmm.
yes
Yeah.
to that. Yes.
Yeah.
Follow, people who aren't promoting weight loss, diet products, that kind of thing.
Photoshopping, they're putting Photoshop pictures up all the
Yeah.
time, because like nobody looks like
No.
those pictures. And
One of the first tools I'll encourage people to try, because it can be such a baby step, but can really go a long way in empowerment, is when those weight loss ads come up and things like that, whether that's on Facebook or Instagram, reporting them as false news is really
Yes,
fun.
I do that.
I
It's a
didn't know
really
you could
fun
do
thing.
that.
Mhm.
That's so empowering.
Sometimes
Yeah.
I would report them as just like, I'm not interested. But you can shift. I don't really get any targeted weight loss ads anymore, because that was a big part of, in terms of the like advocacy work like you were talking about, kind of finding my own voice within the diet culture space.
I
It was
love
just
that.
starting there. Yeah.
Well, and that's like an easy thing. You're on there anyway. You can do it and have a little sense of power. And people like just want to make money.
Yeah.
And, social media platforms just want to give people what they want.
Right.
It's like paparazzi. If nobody ever clicked on that picture of somebody, after a rough night, they would never take another picture
Yeah.
of any celebrities in a vulnerable state.
Yep.
And so I love that little piece of like
Yeah.
feedback.
Yeah.
Yeah, I like that.
And then just, in terms of nourishing the body, just a general thing to do would be to eat every 3 to 5 hours, because our body needs fuel then. And without being specific, that's just something that people can start trying to do, whether that means going to 3 meals a day or, a few smaller meals and snacks, but fueling your body more. And that actually helps for someone who tends to restrict and someone who tends to maybe binge or overeat, because it just helps the body be more stable throughout the day.
Yeah, and I think one of my suggestions would also be, so we talked about like minimizing what information you're getting from ads and stuff. Also thinking about what information you can absorb, even if you're not making any changes yet.
Yeah.
Whether that's reading the intuitive eating book or listening to this podcast or just allowing yourself to be curious and explore, even if we don't feel ready to make change. Because
I like that, because that pre-contemplation stage is also a stage of change.
Yeah.
So allowing yourself almost like that intuitive learning on top of the intuitive eating. I like that.
The process for me of intuitive eating really came from, my mom was actually interested in it, and I was like, all right, I'll read the book. Why not? And started reading it, and I was like, oh,
I like it.
maybe I should do this stuff.
Can you tell listeners what that book is?
Yeah.
Yeah.
So it is the Intuitive Eating Book, an anti-diet revolutionary program that works. It's a lot of words. I think I got them all. By Evelyn Tribole and Elise Resch. It's the 4th edition, is the most recent one.
Okay.
I believe they're actually going to be releasing a new edition pretty soon.
And we'll try to put that in the show notes as well.
Awesome. Great. Yeah. And there's a workbook. So that's also a really great option, is as you're reading the book, you can also do sections of the workbook alongside of it.
Oh, that's the kind of person I am. Like,
Yeah.
I have to like write something in order to like retain it.
Yep. And it's meant to be self-guided. So it's totally doable on your own. So that's a really great place to start. But there are all sorts of resources out there, particularly around body image as well. There have been some really great books. More Than a Body by Lindsay and Lexi Kite is a really great one.
Yeah.
Several that have come out. And if we started thinking the way we think because we heard it over and over and over and over again. And so if we start hearing something different over and over again, then maybe that's what we'll start to think.
Yeah, change those pathways in the brain.
I like that, because like you learn something everywhere. And so, I think we need to like reclaim the word brainwash, right? A healthy version of that is to wash the junk out of your brain and to pick what you want to live there. Okay, so the last question that I have for you both is, what if there's somebody listening and it's not them, but it's someone they love that they're worried about? What can they do?
Mm-hmm.
Yeah.
I encourage people to talk with their loved one and say, hey, I'm concerned. This is what I've noticed.
Mm-hmm.
Can I help you find some help?
Yeah.
So they're voicing the concern. They're letting them know, like, I see you. Offering to, help them
Find
get
resources.
to
Mm-hmm.
some help. And then beyond that, that might be all that they can do if the person isn't willing.
Mm-hmm.
But at least, they've put it out there.
And we're talking about adults, if there's adults in
Yes.
your life.
Yes.
Yeah.
Obviously,
Children,
if they're minors,
it's different. Adolescents, it's different.
go to your pediatrician first.
Yeah.
Absolutely. I love that. This has been so wonderful. I feel like we could talk for like 3 more hours about this, because we didn't even talk about like intermittent fasting and how like crazy that whole thing is. And but thank you both so much for being here. I really appreciated it. And I love the work you do in the community. We will put the contact information of where everybody is. I hope you have room in your schedule, because I feel like there'll be some people listening being like, I need to schedule with Allie. And for our listeners, thank you for listening today. If you felt a story of your own coming up as you were listening, just want to encourage you to find those spaces where your story can be heard, because you're worth it. Be gentle with yourselves, and we'll see you next time. Thanks for listening to How Would You Rate Your Pain? Please subscribe on your favorite listening platform so you never miss an episode. And if this show made you think of someone, please share it with them to help us grow. I'm your host, Dr. Tiffany Bartell. You can find me on Instagram at the_happy_therapist_. This show is not intended as medical advice and should not take the place of therapy or other mental health services. Please consult with your doctor or mental health provider about your own health. You deserve all the support. How Would You Rate Your Pain is co-produced by WaveLength Studios and Chattanooga Podcast Studios and is part of the Podnuga Network. Graphic design provided by Josh Wilhem at JW Creates and music by Michael Crosa. I'm Dr. Tiffany Bartell. Thanks again for listening. We'll see you next time right here on How Would You Rate Your Pain?